Can. Hello, everybody. Welcome to We're Not Giving You Lunch, but this is a Lunch and Learn series from the Department for Behavioral Health, Developmental and Intellectual Disabilities. My name is Michelle Niehaus, and I'm the Program Administrator. And we are so glad today to have with us Anita Dowd, the Executive Director of the Kentucky Commission on the Deaf and Hard of Hearing, and Blake Campbell, Information Specialist and ADA Specialist with the Kentucky Department, with the Kentucky Commission on the Deaf and Hard of Hearing. Our interpreter today is Teresa Lott, and our captioner is Jenny James. You can go to the captioning button so that you can see professional captioning on your screen. Hi, Anna, we're so glad you're here. We are asking people to stay with their cameras off, just to make it easier to see the interpreters. Anna is one of our point people at New Vista, one of our community mental health centers. And our goal today is to help all of our community mental health centers and our contracted facilities know how to best do PR and marketing when trying to engage audiences that may be deaf and sign language users or may have hearing loss. And so that's what we're going to focus on today. You are welcome to ask questions in the chat. Anita will be monitoring the chat and will help with that. And then at the end, after the PowerPoint is done, if you'd rather ask a question in sign language, we'll invite people to turn their cameras on and ask in person, whether it's in ASL or in English, actually. So we want to make sure that Blake has a chance to share some of his knowledge because it's way more than we can cover in an hour. And so we'll start with his presentation and then do Q&A. Before they get started, Anthony's going to go over some basic communication rules. And Anthony, did you want to add anything to communication rules?
Yes, I would. Hello, everybody. I'm Anthony Adkins. I am deaf, speaking through an interpreter, and I'd like to let you know some of the communication rules for the purpose of making sure that we have the questions in the chat. Anita will pass those questions off to Blake. If you'd like to go ahead and sign your questions at the end of the presentation, you'll be able to cut your camera off and do that towards the end. All right. Thank you. I hope you enjoy.
Thanks, Anthony. Anthony and I are going to go ahead and go off screen. Blake, take it away. I'm so excited to learn from you.
All right, let me share my screen. Okay, can everyone see my screen? Let's see. Can you see the screen?
Blake, this is, yeah.
All right, it should be up. Okay, all right. You should be able to see the PowerPoint now. Oh, now I can't see it myself. Bear with me one moment. Okay, just I'm trying to get my screen set up with the interpreter, but with that aside, hello everyone. My name is Blake Campbell. I'm the information coordinator for the Kentucky Commission on the Deaf and Hard of Hearing. I've worked with the commission for 10 years, involved in various information sessions, advocacy, and support. And my biggest role is sharing information, communicating, providing references. Sometimes individuals experience hearing loss and they're not sure what to do or what resources are available, so I provide those resources. And also advocacy is a huge part of what I am involved with. It involves a tremendous amount of advocacy work with doctors' offices and their use of interpreters, hospitals, school systems, even in mental health facilities as well. We provide services there. So I'm excited to show you all what you'll be able to do yourselves and how to improve your PR and marketing strategies for deaf and hard of hearing audiences. I'll give you a few examples of what that advocacy looks like related to mental health settings. We may get calls from people who are trying to find a mental health facility, a treatment facility, or perhaps counseling, but they have zero information and they don't know anything about deafness, hard of hearing, or what accommodations are available to these populations. And of course, going into that research themselves is overwhelming. So that would mean, more likely than not, I would have to provide advocacy for them. Because if not, they'll tend to have the attitude of forget it and drop it as they're trying to look for that help. Typically, what'll happen, they'll call a front desk person to get their needs met, which would be an operator or someone who has no knowledge of these things. And they may just hang up the phone because that's not their role. And then, of course, that has an effect on a person's wanting to seek that information. So it requires a lot of patience, maybe doubly so. And the reason why, because of lack of knowledge. Mental health as it relates to deaf and hard of hearing populations, it seems to be a taboo. Maybe because it's never discussed in families, mental health isn't deemed as important, or maybe the accommodations and available services are just not present. So it makes it a taboo situation to discuss, and a person may not even take that first step to find out information about getting treatment and services. So our role is huge in noticing these various factors that come up. And these are the things that we want to discuss with you today to improve your PR and marketing approach, again, to deaf and hard of hearing populations and audiences. All right, next slide. Before I go more in depths of the what's and whys, I want to point out what effective communication is, because that's key to have the viewpoint from the ADA's perspective. That's a federal law, of course, and it's a well-known law that affects communication access. And for state and local governments and businesses, also non-for-profit agencies, effective communication must be in place for deaf and hard of hearing individuals. Effective communication could mean accommodations. And again, we can ask ourselves, what are accommodations? Well, that would be interpreters. That would be CART services, real-time captioning services. We use CART as the acronym for that. And FYI, we have CART happening right now. So if you haven't experienced it, take the opportunity to cut it on right now, click the closed captioning button, and you'll be able to experience all of that. You'll see how it's done, how people are identified, how punctuation is used, etc. So take advantage of that at this moment. Assistive listening devices, or ALDs, can also be accommodations. It may seem odd that that's included, but it plays a big role in those who you're trying to communicate with, who may use lip reading, who may use interpreters, and it may take more time so that both sides understand what's going on. There is an extended time using these accommodations, especially for people who lip read. It definitely is going to take longer to make sure they are getting the information via that way and that they understand. It may seem odd to you, but these are in fact accommodations. I'd like to also point out interpreters. You have two options: an in-person interpreter or VRI, which is a virtual remote interpreter. And those are nice options to have, having someone in person or virtually. You may feel off that an interpreter is involved in the exchange or that they're looking at you. Maybe you prefer VRI, and that would be the interpreter being used on a laptop or a tablet. If you don't want someone in your state to know who you are, you want to keep it more confidential, VRI is an option for you. So I wanted you to know about those two options when you are seeking an interpreter. You can have one virtually, VRI, or in person. As far as assistive listening devices, or ALDs, there's a plethora of choices in this department. And it just depends on the type of equipment that will be used and provided, or if a person has a personal assistive listening device. For example, maybe a person has a hearing aid or a cochlear implant. They may have what's called a pocket talker. It's a device that they're able to listen clearly using that pocket talker device. And it's something that they will hand off to you and ask you, do you mind using it? And then you would keep it near you so that they're able to hear, the communication is effective and smoother. So a pocket talker is one example of an ALD that can be used to make communication effective and understandable. I have the box at the bottom of my PowerPoint that says effective communication is particularly critical in mental health care settings where miscommunication may lead to misdiagnoses and improper or delayed mental health treatment. And I'd like to place emphasis on this. Sometimes a person may think that it's okay to use writing notes back and forth in this type of setting, but we're talking about effective communication being based on what the law requires, and that's making sure that the exchange, the conversation taking place is understandable by both parties. If there's a diagnosis or a treatment that's happening, it will make things easier in the future if things are understood in the beginning.
I'm Anita, and the executive director here at the commission. And I just wanted to jump in and add a word of caution related to lip reading. I know that TV and movies can be a little bit misleading. And there used to be a TV show called Sue Thomas FBI. And I think that person could lip read around the corner. And that's not true. It doesn't really happen. I think everybody to some extent does a little bit of lip reading, but even the best is 35% accurate. So that leaves a 65% margin of error. We caution about that. There are some people who consider themselves hard of hearing. Maybe they say, I have a hearing loss, whatever. They prefer to depend on lip reading. If that situation happens, it's a good idea to reinforce conversation Ask open-ended questions to make sure they're truly understanding, because many times we think we understand something and don't realize until later that we didn't understand. Writing, also back and forth, is preferred method or accommodation for some people. That's fine. However, we caution against the cliff notes. People will tend to give the short version. In any kind of health, whether it's regular medical health, mental health, physical health, we deserve all the information and not just the abbreviated version. There are multiple apps that are available for iPads and phones that you can use to help with that, to shorten it, so that you don't actually have to write everything. We can share information about those apps that are available if you're interested. So let us know.
Yes, that's an example of the extended time needed. Anita's information right now that she added to make
And
sure that everyone understands.
the key is that every individual with a hearing loss is different. Even though I speak, I still require an interpreter or captioning to understand. There's people like me out there that muddy the waters and help keep everybody confused. I apologize for that, but it's always the best practice to ask the individual what works best for them. Ultimately, that's the goal. We can't dictate what works for any individual, and we can't, it's not one size fits all. They have been through it. They know what works. Occasionally, you'll encounter somebody that doesn't know. In that situation, you may just have to try things to see. But always ask the individual what's their preferred method of communication.
Okay. So again, that's effective communication under the federal government's definition. So for PR and marketing, it fits there. For PR, how can you market or announce your events? For marketing different events that you will have, whether it's on a flyer or what have you, we encourage you to use this verbiage. Now, I know that you will be willing to provide the accommodations, whether it's captioning or interpreters, and you want to put that on your flyers or your registration form. Put that on anything that you know is related to events and that people will use to sign up or to respond to you. And here's the verbiage on the screen. And keep in mind, you want to make sure you put per request. It's right there. You can use this exact verbiage. Put down if you're going to request accommodations, please contact, and put the specific person to be contacted instead of using like the general box office or the general office where the location is, because no one may answer, or the person that answers doesn't know what to do and may end up sending that person up an extensive phone tree to find what they need. And it might be possible that you may need to train all of your staff on what to do. So if they answer the phone, that they know how to take the request for accommodations. So again, I encourage you to put this exact information on your flyers and registration forms. And we recommend this be, and also put down that they request this 2 weeks in advance. We recommend that. So that, and if you, so that you know interpreters will be available, there'll be enough time to have people available instead of looking for an interpreter last minute. If you don't have a registration process, then go ahead and put the information on the flyer itself. If you're hosting a big event at a park, or if it's an open event, something open to the public and you know the location, put down the accommodation information right on the flyer. So I strongly recommend you to use this exact verbiage that you see on the screen. And also you'll see the logo on the screen with the closed captioning signal. People easily identify. If a person is deaf or hard of hearing and you put those logos, the closed captioning on the left and the interpreter hands on the right, if you include them on your flyer or registration, they immediately know that you are offering accommodations to them. Maybe a person is blind and they will need Braille, or if it's a deaf or hard of hearing person, they'll easily identify, oh, wow, this event actually will have accommodations available. We can be included in that. They're willing to do this. And it will spark excitement in the deaf and hard of hearing communities that interpreters can be put in place. So put those logos down also, because they're easily identifiable. That's going to be your best way to advertise to other populations that you are going to provide those accommodations.
I just want to add that I saw in the chat, in case anybody missed it, that anybody that needs those logos can contact Michelle and she'll share the logos with you so you can use that on your PR items, PR information.
Exactly. All right, great. So if you're advertising an in-person event, that's one thing. But what if it's a virtual event, some type of virtual meeting or an online session that people will be joining? I'll explain on the next slide how to approach that. Okay, obviously you're in a virtual event right now with us. So you have already seen some of what this looks like, you know, as far as we're telling you to turn on captioning, you're seeing that you're able to do that. You are experiencing an interpreter in real time, voicing for me, and how that's going to work virtually. So it's very simple. But some hearing people are not, there are some unspoken rules that make things easier in a virtual setting. When you're ready to invite people into the room virtually, let them know that they are able to turn on closed captioning and what other accommodations are available. Also inform them that how they can access the interpreter so that deaf and hard of hearing individuals joining your session can take advantage of that. Now, a lot is going to depend on who's using the chat. I would recommend minimizing use of the chat unless it's announced that it's going to be used. Sometimes you'll notice people typing extensively in the chat while the session is going on. Questions are flying in the chat, and you can visually see it happening. And once you do, a person may look at the chat and miss what's actually happening in the actual session or meeting. And so it creates a lot of visual noise on the screen with so many things happening at the same time. But using the chat for questions is reasonable for periodic questions that come up, but just kind of minimize the use of it. Don't overuse it so you don't have so much visual distraction. For audience participation and taking turns and raising hands, without raising hands, it becomes difficult to attend and difficult for the interpreter to know, as well as the captioner, to know who's speaking. So encourage people to use the virtual raised hand first so that the moderator or the person leading the session can see that, acknowledge them, and then they can go ahead with their comment or question. It makes it easier and more comfortable for everyone involved to know who's speaking at one time and take turns. And also announce the name of who is speaking before they start signing or talking, so that the interpreter can know, oh, that's a different name, that's a different person. They can communicate that to the deaf and hard of hearing individuals so they know that someone different is speaking. So that name will also help the CART or captioning person too to know who is speaking, who is signing Without that, it can be very overwhelming to keep track of who has the floor. So it's a nice feature. I'd like to emphasize also one thing. People tend to get very excited that captioning is available. But one thing that we have to keep in mind is that sometimes captioning is automatically generated. It's a voice recognition service, which is the worst possible thing you could use as far as accuracy. So just keep in mind, like if you're using YouTube or something like that, you can see that the auto captioning has a lot of mistakes in it. And the sentences tend to be run-on sentences with no punctuation whatsoever involved. So you can't tell when another person has started speaking. Could be 3 or 4 different people speaking, but all of those sentences are run on. And it's exhausting visually for you to even look at that. You may have misunderstandings, you may receive wrong information, and realize how wrong the captioning is. And it can even make people not want to be involved in future meetings because of it. So that's why using a cart captioner is the perfect remedy for those mistakes. You can easily identify who is speaking, who is signing, and I think it's just a great feature. So keep that in mind for a very serious meeting, something more in-depth. You don't want to use the auto captioning that's built into any system. It's best for you to go ahead and hire someone to take care of that and get cart services. All right. So you know about in-person meetings, you know about virtual meetings, what you would need to do. And that's all the information that we have related to PR events. Now, if you want to make sure that you increase the number of people who are going to be involved in your event, maybe you're going to use a website, social media, kind of build some ideas about that. We'll go to the next slide and discuss it. Now, you know that everything is online. People are heavily reliant on the internet. If someone is searching, they're going to go to Facebook, they're going to go to social media, they're going to go online digitally to find information. So one way that you can improve your reach is to add direct links for deaf and hard of hearing services, and embed that right into the website itself, so it's easier for a person to be able to access what accommodations they can request easily and quickly. They can actually click on that link directly, pick what accommodations they need specifically for them and their needs. It can build a lot of trust between you and the deaf and hard of hearing participants. Because now they don't have to be overwhelmed by their needs. I mean, for example, I had to Google search mental health Kentucky, deaf, and then click on search on who already had information on their websites, you know, ready for a person to click on and use, already have the links. So that a person can see what events are available, what's happening, what programs you offer, what services, what accommodations, what's provided for deaf and hard of hearing populations. And it puts people at ease when they're able to easily get that information, access it, and just click on a link and be able to say, oh, okay, they have XYZ available, as opposed to making call after call and contact after contact and being told no repeatedly. So have things embedded in your websites so that it's easily accessible. You can even put the programs, the services you offer there, even short videos there, so that people can have it. Sometimes if people say, oh, they don't have captioning. Oh, but they have voice recognition captioning. It's going to have errors in it. They may say, okay, forget it. I won't even be able to understand the video or what's happening. I'm not even going to bother. So if you can go ahead and make sure you have a captioner, caption your information that you have on your website, because keep in mind, a lot of hearing people rely on closed captioning, as well as deaf and hard of hearing individuals. So I encourage you to go ahead and use it for your websites. And you can even be able to have a voice component where if any repairs need to be taken with the captioning later, it can be fixed later. So with voice recognition built into the website, let's say there needs to be something clarified. If the voice is actually recorded or being included, then you can go back and fix it later because you had that feature already built in. You can find a captioning company, or you can find software that will do it, or do it yourself. That's possible as well. But make sure that your online content is more inclusive by using closed captioning. You can even include ASL videos where the person is signing into ASL. There are some deaf therapists that they will embed a video with them signing, explaining their programs and what they offer, that they offer services in ASL. They'll embed that video into the website. And they even sometimes put in information that they can help find interpreters. And they're actually signing that information right into the website. They're able to sign, we have these services. We will work with you. We provide interpreters when you come and get treatment here. And it just clears things up on what's available. Now, what you can do if you don't sign yourself, you can ask someone to sign that video so that you can use it for your website. Or you can have an interpreter with you as you speak and have that person interpreting your message. And again, you'll have someone pull up your website and think, how cool is that they're providing this service? So again, that's how you expand your reach using videotapes with interpreters or deaf people themselves signing the information, and they can find out more about you and what you offer. Now, of course, don't forget to add verbiage related to requests and accommodations for all of your events, for all of your virtual postings, whether that be on Facebook or any other social media. Again, flyers, everything that you can think of. Facebook has a separate events page where you can put the event and the description of the event itself and what accommodations are offered so that people know what they will get when they need it. So again, it's all about building trust with different communities, them understanding that you're willing to provide accommodations for deaf and hard of hearing people, and that you're looking for them. So now you know what to do with your PR, with your marketing. You know how to be more inclusive. I'd like to now give you a few tips on how to improve. Let's look at the next slide. Some of you may not realize it, but English is a deaf person's second language oftentimes. If they haven't had English as their first language, some people will struggle with it. So keep your English vocabulary on your websites, your flyers, and other forms. Keep it plain, keep it simple. And as deaf people, we are very, very visual in how we take in information. So why not include some infographics, some pictures? Like we said, the logo showing what accommodations are available. And that provides visual content on whatever poster or whatever you're using to draw people in. So again, keep things very visual using infographics and pictures. Now, do not, oh, yes.
I'm sorry to interrupt. We need to pause for a second. The captioning has stopped, so we need to make sure that that is working okay. Anita, are you seeing the captioning on your end?
This is
And
Blake.
Blake
I'm
is
seeing
seeing the
it on my,
captioning?
yes, I'm seeing it
Okay,
on my.
I was getting messages that it had stopped. So, all right, I'm sorry to interrupt. Keep going. You're giving us great information.
What about, I want to make sure Anthony has his captions up. Anthony, are you able to see them? Okay, great.
Okay, great. Thank you. And this is an example of sometimes you have to stop midway just to
Yes,
make sure that everyone has the same access.
yes.
And it's okay. Thanks, Blake. Keep going.
All right, thanks for checking in with us. I appreciate it. Technology, whew, yes, we definitely want to make sure that communication is effective. Oh, okay. I'd like to emphasize, do not set up accommodations for an event if you have not received a request for them. Now, I know that many of you want to do that out of the kindness of your heart. You're like, oh, we don't have a request, but let's go ahead and have interpreters. Let's go ahead with these accommodations. But it can be a dangerous precedent to set up, because if you have an interpreter in place and a deaf and hard of hearing person does show up and says, oh, well, they have an interpreter present, I don't need to request one at any point in the future. And then that will cause you, having set that precedent, to set up an interpreter for everything you host moving forward. And that causes the deaf and hard of hearing participants to say, oh, wow, they have captioning. I didn't even have to request it. Or they may find out later that there were accommodations, but they weren't announced and the person didn't know about it. And they were like, oh, I wish I would have known. So again, emphasize, if a person needs accommodations, they will be provided by request. And it allows people to, that allows you to put the responsibility on the participants that need those accommodations. If it was a perfect world, of course, all events would have everything that's needed. They would have interpreters, but that's not a reality and it's not a possibility. So when you think about providing accommodations, do it by request and emphasize that. Also, cost is a factor involved in this. You always want to include a budget for the accommodations that you're going to be provided. Imagine if you had that budget and applied to every single event that you put on. So keep in mind, cost will be involved in this. Budget it. A lot of times entities are concerned about cost, but keep in mind, this is a legal matter. These accommodations are required. And to make it happen, set up a budget plan at the beginning of your fiscal year so you can figure out what will be allocated where. You know, what's the budget for communication access? How much money is going to be poured into that so that you can have the funds ready to provide the access that is needed. There's also tax incentives for businesses. So, you know, doing this, there are some tax incentives to providing accommodations for deaf and hard of hearing individuals. So if you're curious about that, look into it. It could really help you out. The federal law is requiring these accommodations. So that's why it's imperative to plan it out beforehand. Look forward to what events that you're going to put on, what events that you're going to need interpreters for, what events you're going to need captioning for, and have enough money so that your budget is flush and it's comfortable for you to be able to do what you need to do. So contact the ADA hotline if you need more information. Now, I personally am ADA certified, but I even depend on myself contacting the ADA hotline to get information. There are some situations that will come up and you'll be unsure how to move forward. So feel free to call the Americans with Disabilities Act hotline. They have a lot of resources and information clearly laid out, and they can find what you need so that you're in alignment with what's required. And of course, we at KCDHH are here for you. We will make sure that we can help you with information and resources that you need and helping you know where to go to get that information. So you can definitely contact us at the commission. So again, it's a beautiful concept to be able to have that choice of in-person, online, websites. These tips will help you in all of these different arenas. There's no ceiling to how much you can improve what you offer to deaf and hard of hearing people. The resources that you're willing to provide for us makes it easier for us to find information, for us to know what events we want to attend. And it just makes our world easier here as Kentuckians. We are here. We know that you care about us. We know that you have services for us. And if you actually advertise and market this way, we know what's provided, and these tips I've given you are a good way to do that. So, with that aside, we can help at the commission in so many different ways. We have an enormous amount of information that we could provide and resources. We have our hand on the pulse of what's going on in the community. We know where to refer you if you're lost, and if you don't even know where to begin with all of this. We can find that information and we bring it directly to you and save you from doing that legwork. So I think I pretty much covered that. If you're at a loss of where to go, contact us as a starting point. We can give you the answers you need. We can help you be in compliance with the ADA. If it's a situation where an entity or a person is refusing to provide accommodations, we can support you in how to navigate that as well. And we also provide training. If your center feels that your staff needs event training, or you need some general information, or a little bit more in-depth meat as related to the ADA, or you have hard of hearing people please reach out to us. We are happy to train you, to work with you in person or on Zoom with your staff members. We also have a telecommunications access program, or a TAP program, in our office that provides free equipment to deaf and hard of hearing individuals, such as iPhones or tablets. And so maybe people that you know would benefit from that. Maybe you have a client come in and they have no idea how they can get a phone or a tablet. They're struggling to communicate with the people in their lives. And if that's the case, recommend KCDHH to them. They can contact us, and we're happy to stay in communication with them or their family members, because it's critical to keep communication going at all times. We encounter customers and consumers like that all of the time. People contact us. Sometimes we spoon feed them information if they're starting out. And so we want to make sure that you know about that TAP program. So that's what I have as far as us. Anita, do you have anything? Okay, hopefully all of you have learned something. If there are any questions that you have, feel free to go ahead with your questions. I'm going to close out my shared screen so we have more screen real estate as we take the Q&A. Okay, all right.
This is Michelle. Thank you so much, Blake, for that overview of not only how to provide good PR and marketing, but how to really build trust with people who are deaf and use sign language, or who have hearing loss, to make sure that the communication is there. We want to make sure in all of our programs that the effective communication is established first, so that when people contact them, that it's not a question of whether or not it'll be provided. It's just about what's going to be the best fit for you as an individual. So please feel free to pop on screen and ask any questions. Does anybody have any burning questions for Blake or Anita? Blake did such a good job. Nobody has any questions.
Thank you.
Anita, I know you love to talk. Are there any things that you would love to say to our providers about how to best let the deaf or hard of hearing communities know about access to mental health services or to other events?
I remembered my mute button. Yes, I like to talk. You know me well. Well, first of all, really, I would like to thank the people that have come, that have made it a priority to learn more about how they can accommodate deaf and hard of hearing consumers. We all know that mental health is scary and challenging, and it's even worse when we can't get the basic, when communication is a barrier, and that just compounds the problem for everybody. The key, I think, is first asking consumers what works for them, what's most effective for them. Second is knowing the resources. If nobody remembers anything from today, but they remember they can contact KCDHH if they have a question, that's a good thing, because we're happy to answer them. If they have contact us every day, we're fine with that. That's our job. And sometimes it is hard. We get stuck in our everyday thing, and hearing loss being low incidence, often what we learn before we are faced with dealing with another person with the hearing loss, we've forgotten it. So, but there are resources out there. We know that everybody has budgets. Sadly, they're not unlimited like we wish. So we know sometimes the provision of accommodations can be challenging. But it's important to know that they are required by federal law.
Mm-hmm.
And the more you know about what's available and where to find it, the easier it will be to get it in place and to keep the cost to a minimum than last minute. So like Blake said, this is something that actually the federal law has been preaching since the middle 1990s, build the cost of accommodating individuals with disabilities, not just deaf and hard of hearing, but all of them. Build that into your annual budget because it's considered a cost of business. I would like to say that deaf and hard of hearing individuals will not ask for an accommodation if they don't need it. Some situations, Blake and I have experienced situations where individuals have asked for an accommodation at some point that they didn't ask for before. And the provider's like, well, why do I have to provide it now? They didn't use it before. Well, it's very possible that they didn't realize they could ask for it. Or it's very possible that they thought they were understanding everything, and then something brought it to their attention that, they missed something important, and now they're a little traumatized, and they're like, I don't want to miss anymore. Or for some reason, they've become more empowered about asking for it. I don't think that it's something that anybody ever asked for just to cause a problem. And I think the majority of people with hearing loss that do depend on accommodations, keep in mind, there is a cost associated with that. And so they're careful to make sure not to be excessive. So I think that pretty much covers it.
Anita, thank you for those comments. I think that as you're talking, it just made me think about how important the work is when we're working in mental health, substance use, or developmental intellectual disability services, because part of our jobs as professionals is to help educate the folks we're serving about accommodations as well. And some of our folks may not feel comfortable asking. They may not know what's available. So case managers can do a lot to help educate. Having that information available readily, like Blake said, makes it a little bit less hard. It's already difficult to ask for help. And if we make sure that they don't have the additional burden of trying to figure out whether or not accommodations will be provided, they may be more willing to come and seek that support. Yesterday, I was in a meeting about equity, and somebody presented on language access services. And what they said was a budget is a values document. And if you don't have communication access or language access in your budget, then that's reflecting the values of that organization. So I really do encourage everyone to make sure they include communication access and language access in their budget to reflect the value we all hold of respecting the dignity and the humanity of every person that we serve.
Thank you.
Because it doesn't matter how amazing a service or a provider is, if the person they're working with doesn't have access to what they're saying, the service is no good. So.
Yes. It's the same thing on the national level with the 988 services. You know, adding sign language to that, expanding the service. It's a trickle-down effect when you're trying to save people. So just getting more exposure out there from the top down, from the national level on down, there's a lot more to it than you think.
Absolutely, Blake. Thank you both so much for doing this presentation and for being the wonderful partners that you are, not just today, but every day. Do you have any final thoughts before we wrap up?
This is Blake. No, I don't think I do. Yeah, just contact us again if you need any further information. We're here for all of you. Yes, and the deaf community definitely as well.
Thank you both so much. Thank you, Teresa. Thank you, Jenny. And I hope you all have a wonderful rest of your day.
Okay, you too. Bye-bye, everyone.